Welcome to Healthcare Tech Talk, a podcast looking at tech talk with a twist. Listen in as our experts from Brillio invite leaders from some of the largest healthcare systems and companies across the US to discuss and share how they are transforming healthcare. It's a tech talk and real talk from the people who are working to transform and improve healthcare every day. I am Aman Sharma, the Global Head of Healthcare at Brillio. Let's get started. On today's episode, we welcome Aman, Bhasin, who is the visionary CIO for healthcare payer and provider organizations, exuding forward-thinking leadership and pioneering innovative, often first-to-market solutions to create competitive advantage and customer delight. With over 20 years of experience in IT leadership, Aman has led teams to execute with agility and speed and enjoys high-growth environments. He's goal-focused and is known for always delivering on promises and producing business-impacting results. In his current role as Chief Information Officer at Canopy Health, Aman provides the management and vision of all development, innovations, and technology operations for the company. Under his leadership, Canopy Health rolled out the industry's first unified platform for members to access both coverage and care, integrating multiple providers and payer organizations together. Well, welcome, Aman.
Thank you, Avantika. Thank you again for having me here. I'm excited about our conversation today.
All right. So today we are going to talk about how big tech companies like Amazon, Apple, Google are disrupting the healthcare space. So, Aman, large tech enterprises have been hoping to be part of the highly regulated $3.8 trillion healthcare market for over a decade, only to be met with minimal success. Do you think big tech will be able to disrupt this space?
Yeah, there's no doubt in my mind that big tech has significant potential to disrupt the healthcare industry. These companies bring lots of resources, advanced technologies, considerable expertise in areas of artificial intelligence, cloud computing, data analytics, and user experience, all of which can be used to transform various aspects of healthcare. In addition, the pandemic presented them with a new window of opportunity. Rapid changes in consumer expectation and scalable technologies are moving to the market at faster speeds. And with healthcare providers and patients more willing than ever to adopt these new technologies and explore new models of care, that the healthcare space is expected to continue to grow and remain as a strategic focus for these big tech companies in the foreseeable future, I think. One of the main advantages these guys have is the ability to be quick and effective in addressing the increased demand, faster, more transparent, and convenient healthcare services across the entire ecosystem. Right? They've had significant investments in healthcare, M&A deals, and partnerships to help develop products and services. The most prominent players leverage their expertise in software development, device wearables, cloud computing in order to get ahead of the competition. They've had the size and the scale of operations to handle the volume of data that overwhelm healthcare providers and payers today. So I think in some of these areas where they'll continue to make progress include telemedicine, data analytics, and AI, especially now with the advent of things like ChatGPT, their expertise in handling big levels of data and making predictive analytics, having things like disease surveillance or even personalized medicine are all things that are going to be able to mine the data and come up with actionable outcomes. Wearables and health tracking will continue to grow, I think, and be more aligned in feeding those big data areas so they can have better predictability. And then even in infrastructure services like cloud services, where healthcare is just housing a huge amount of data, the big tech companies have opportunities to offer cloud services for storing, processing, and security of all of this healthcare data.
All right. Thanks, Aman. Thanks for sharing that insight. From your experience, why do you think big tech companies are entering the healthcare industry? Is it their need to be more relevant across the value care? Or do you feel that healthcare has a huge potential to be disrupted?
So yeah, I think big tech involvement in the healthcare industry has grown for several reasons. First, it's a huge addressable market, like you mentioned, north of $3.8 trillion. That, coupled with the rising cost of healthcare and the high admin burden on payers and providers, has created a vacuum that smaller health enterprises need help in filling. Healthcare is a goldmine for product and service development, and big tech investment has accelerated growth and innovation. Their funding backs lots of solutions that lower healthcare costs, improve workflows, and drive further automation. In tandem, healthcare consumer demands for digital solutions has increased dramatically as well in the last few years. Consumers want the same efficiency and convenience that they're used to in all other aspects of their lives. Big tech has the expertise, and they have the product resources to develop these digital solutions more rapidly than traditional healthcare actors have. Big tech core competencies in areas like artificial intelligence, including recently hot topics of large language models, machine learning, and others like natural language processing, data analytics, and user experience, and can provide valuable insight into the healthcare sector. For instance, they can help improve diagnosis, treatment plans, outcomes by better leveraging data. There's an opportunity for alignment for these companies with existing products and services. So companies like Google and Apple and Amazon have had existing products that dovetail with healthcare related services. For example, wearables from Apple Watch are already gathering health related data. Google search engine is often used for health related information searches. Amazon has an extensive distribution network that can be used for medical supplies and pharmacy, as they're doing today. There's data analytics, where healthcare generates an enormous amount of data. Health tech companies have the capabilities to handle and analyze and derive insights from this data, which can be used for various purposes, including disease prediction and prevention, personalization of treatments, and research. The next area I think that is prime is the growing consumer expectation that we talked about. So consumers are increasingly expecting digital convenience and personalization in all aspects of their lives, including healthcare. Tech companies have a track record of meeting these expectations in other domains, and there's no reason that they can't bring it into healthcare. And then I'd say, last but not least, the potential for improving healthcare, right? So it's an opportunity for them to get in the healthcare space and make a difference that they can actually impact somebody's well-being. And it's recognized that the healthcare systems worldwide face significant challenges, from aging populations to increased burden of chronic diseases, and technology can really help play a major role in addressing these issues.
Well, thank you, Aman, for laying down so clearly for us and for our listeners about how and why is big tech thinking about entering the space. And I'm so glad you did talk about AI and the recent, I would say, talk about LLM model. I mean, there's no conversation if you don't talk about ChatGPT within the first 20 minutes. I'm so glad you brought that up as well. So, Aman, can you specifically talk about how do you think the acquisitions that the big tech have been doing? We have all seen, some of them have been very strategic. Some of them have been vertical integration based. However, these acquisitions seems to be something that I've been playing in for the last, I would say, 10, 15 years. What do you think about it?
Sure. Yeah, there's certainly been a trend. And as I was kind of prepping for this conversation, I looked up some things that are really interesting in terms of how the progression has gone. So in 1999, it started with Amazon buying drugstore.com for $40 million, and Microsoft acquired WebMD for $450 million. That was kind of big deals at the time, and it started a wave of acquisitions, right? So Amazon, starting in 2018, acquired PillPack and really got into the online pharmacy space. And they've been leveraging their logistics and distribution capabilities in order to bring pharmacy to the home. And later acquisitions, including Health Navigator in 2019 for online symptom checking. That was a startup doing that. Triage tools to direct patients to their appropriate healthcare services and so forth. So they've also experimented, as we know, recently in Amazon Care, with telemedicine service that Amazon employees and other companies can access. So they're primed to get into healthcare in a big way. Right? Apple, they've been a little more subtle, but certainly they have bought companies like Glimpse, the personal health data startup, in 2016, and hoped for aligning that with their products. And I think it really likely helped them in development of the Apple Health app, which is used to collect and view healthcare data in one place. There was another acquisition of Bedit, sleep monitoring device maker, that could be part of Apple's plan to extend its wearable technologies into more specific healthcare monitoring. Google has also had several acquisitions since the early days, and prominent ones recently include Fitbit, which was a major move on their part. And with the wealth of health and fitness data that they're gathering, they're going to be able to do a lot more on data analytics. So DeepMind coming to mind as another. I think that their parent Alphabet has also actively been involved in healthcare related projects, including mobile apps for hospitals and doctors and nurses. And then last but not least, Microsoft acquired Nuance in 2021 and got into AI and speech recognition. And obviously, we know their involvement with ChatGPT, and they're bringing lots of different technologies into healthcare and also on their services side, including Azure infrastructure. So I think in summary, all of big tech is playing a huge role in they are acquiring, partnering, and moving to try to be at industrial scale capabilities for enterprises and small healthcare companies alike, and leaning into their expertise to develop portable health hubs and clinical research tools. It's something Apple's doing, Google advancing in AI and data storage, and then Amazon being very ambitious in getting into everything from brick and mortar to telehealth.
Yeah, and what's interesting is that, with these acquisitions on the big tech side, we are also seeing some of nation's largest payers and pharmacy benefit management companies acquiring and investing in data analytics companies. So clearly, the direction seems to be in being more member-focused, member-driven, focusing on acquiring companies that are enabling you to provide a complete healthcare to a member instead of just being a payer who's processing your claims or pharmacy who's delivering you medicines, but how can you actually reduce the administrative cost that has been plaguing the entire system? So that's insightful, Aman. Thank you.
Absolutely.
So what would be your key message for our audience who is listening now and probably thinking about, well, we have the big tech, sort of coming in. We have a lot of investment that the payers and the providers are doing on technology services. So any feedback that or suggestions or anything for the audience who are listening, who could be, some of the CIOs from these payers and providers companies, or maybe members who are just trying to understand, well, am I ever going to have affordable and accessible care?
Yeah, sure. I think, in summary, I'd say there's like 4 areas that we need to think about, right? So the first is that the first point is there's potential for transformation that is huge, right? So big tech like Amazon and Google and Apple have enormous potential to revolutionize the healthcare industry because they have the resources, they have the technology prowess, they have the expertise in areas like AI and data analytics and user experience. So whether it's through improving telemedicine services, offering healthcare tracking devices, providing robust cloud services, or employing AI for predictive analytics, these companies can do significant innovation into the healthcare space. The second thing I'd say is there are challenges and barriers, right? The potential is clear, but the road to disruption is full of potholes and detours. Our industry is heavily regulated, as you know. Companies need to navigate these regulations and still focus on preservation of patient safety and privacy. And healthcare is a very complex area, and we know that from some of the recent challenges and failures of companies that have come into healthcare. So they need to understand to collaborate more with companies that exist in healthcare and understand the providers and the delivery systems in order to ensure the effectiveness of their solutions. The third thing I'd say is the acquisition strategy, right? So as part of the approach to breaking into the big sector of healthcare, these tech companies have made strategic, acquisitions to augment the capabilities. And I think, PillPack and Health Navigator and Glimpse and Beddit are some of the ones we talked about. And this is going to continue. So these acquisitions are going to offer a fast track for these companies to get into healthcare and supplement with providing valuable infrastructure, technologies, and market presence. And then last but not least, really important is the consumer role and expectation, right? Today's consumer is pivotal in shaping the landscape, right? They want that digital convenience, they want the personalization, and traditional healthcare companies haven't been able to solve for that. Tech companies have been very successful at solving for it. So you can really see that as a big opportunity for them coming together. So I think those are the four areas. In conclusion, I'd say, just big tech into healthcare could bring a whole new era of innovation and improved services, but the potential has to be balanced with careful regulation, collaboration with existing providers, and continuous focus on patient safety, privacy, and trust. As we move forward, I think the dialogue between healthcare providers, regulators, big tech companies, and patients will be important in order to shape the future of healthcare and combine the best of technology with the highest standards of care.
Very insightful, Aman. I don't think 6 years back I would have heard healthcare personalization and consumerism ever in the same statement, but clearly the winds are changing. We are seeing a lot of investments that the companies are doing themselves within healthcare. And so, as you mentioned rightly, and so is the tech enabling most of it. So really looking forward to how this can actually help at the end of the day millions of lives who can have more affordable and accessible care. So thank you so much. Thank you for providing your insights and being our guest today.
You're very welcome. Thanks for having me.
And for those of you listening, you can learn more about this show by visiting the program page on healthcarenowradio.com, and be sure to connect with me on Twitter and LinkedIn. I'm Avantika Sharma. Thanks for listening. Healthcare Tech Talk is produced by Brillio. Brillio is a global leader in enterprise digital transformation solutions, providing strategic consulting and implementing digital solutions for Fortune 500 plus customers. You can learn more about the company at Brillio.com, and be sure to follow us on Twitter at Brillio Global.